Okay, so we are actually trying to look at the central cause of cancer of the cervix. Alright, like central cause of the central cancer of the cervix. Okay, many factors could actually predispose you, but looking at the cause in depth. So we're trying to focus on human papillomavirus. You can see that most pathophysiology pictures of the cancer of the cervix that I see on the internet, you see human papillomavirus infection there. So how does this human papillomavirus actually lead to cancer of the cervix? That's what's on this video actually trying to focus on. So first of all, we have to admit the fact that it is actually the central driver. Okay, if somebody's supposed to have cancer of the cervix, is a central driver. Okay, so nearly all cases of cervical cancer are linked to what? Infections of the human papillomavirus that have been persistent, have been there for a long time. Okay, so how does this human papillomavirus even cause cervical cancer in the first place? So initial infection, so it infects the basal epithelial cells of the cervix, typically through what? Micro abrasions, okay, during sexual contact. Okay, so there's like wounds, during sexual contact. So most infections are transient. Okay, that's like most women are infected by this, but most of it doesn't even lead to cervical cancer. It comes and it goes like that. So persistence of high risk human papillomavirus, especially the type 16 and 18. So up to 70% of cervical cancers out there you see are caused by this type 18 and 16. So if you're having continuous infection, that's if this is you are getting infected is clearing, but you are continuously being infected by this. Okay, this will now, after a long run, it will disrupt how your cells are regulating their cells. So we have oncogene activation. So human papillomavirus expresses what? E6 and E7. Now E6 will inactivate P53, while E7 will inactivate RB protein. So all of those things we listed are very important in cell cycle. The cell is growing, the cell should know when to stop. Okay, so if you are disrupting the cell cycle, the cell is just growing like that without knowing when to stop or when to continue. So we have progression to dysplasia and cancer. So we have changes known as a cervical intraepithelial neoplasia. Okay, progresses. The stage 3 of it is when it's now almost becoming cervical cancer. Okay, so why is this human papillomavirus the center? We said that it's usually found in 99% of all cervical cancers. If you do a histology, microbiology, you pick up the human papillomavirus, right? So if you want to prevent cervical cancer, this organism is like the center of focus if you want to prevent cervical cancer at all. So fortunately, we have some vaccines that they use out there to prevent cervical cancer. So vaccines like Gardasil, then Cervarix. Okay, so regular pap smears and also human papillomavirus testings. Okay, then if you have a precancerous lesion, okay, you can early on treat it. Okay.